So I choose to present some data from the International Society of Systemic Autoinflammatory Diseases, only some snapshots because I wasn't there, and also some data from the EULAR. They are coming also from the Reliance registry, which Tadej was mentioning. So from the ISSAID, only snapshot, very interesting discussion about points to consider for early stages of diagnosis macrophage activating syndrome from Scott Khanna, and also difficult to treat systemic GIA, which is also a very important subject. And we will hear maybe something tomorrow about this. And two other talks, very interesting, about maybe future treatment, about IL-18 inhibition in autoinflammatory diseases, and also about interferon gamma, and maybe also with some therapeutical idea. Tadej was already speak about the Reliance study, which is based in Germany. The patient with autoinflammatory diseases treated with canakinumab are enrolled in those in this study, in this big. There were three posters, from two posters and the oral presentation from there. All three of them were about safety. Some of the things were already discussed, so that's about general safety for all the patients in the registry. You can see there are 232 patients in the registry, and the adverse events are around 800. You can consider that are more, but they are not so much, because related to the drug were only 202, and also the severe side effects were very low, 98 together, and only 31 related to the drug. Also, the total side effects were generally decreasing on neutrophil count and increasing in inflammatory parameters or nasopharyngitis, so were not severe at all, and they didn't go to the stopping of the drug. Important idea is that with treatment, and in the last 3 years of the treatment, the incidence rate of the adverse side effect is decreasing. So maybe in the beginning of the treatment, we have to be more careful, because after this, side effects are not so significant. And also a very important point you can see here in the last rows are the doses. In the middle, the standard dose. In the left, the less than standard, and the greater dose than the standard one. And you can see there is a clear difference regarding the doses, because high dose is correlated with much more side effects. And here are two other similar posters on CAPS. So CAPS, from the 232 totally autoinflammatory patients, 107 were CAPS patients. There were also, again, not many differences and not very serious side effects. Generally, the patients were going well, and they were report stable low-level disease. There were no significant differences in the response of the treatment regarding the disease we are talking about, or regarding the severity of the disease. And the patient assessment and the physician assessment were concordant, and everything was okay. And also the interim analysis demonstrate that it's safe and effective in more than 2 years. And the last is on TRAPS. The same idea, no many and no significant side effects. Differences between the doses. There are patients with smaller doses, general doses, and at 36 also higher doses, but the rate of side effects was not significant, and also that it was no severe, and it was not needed to stop the treatment. These are the data for the TREPS, not so many patients, 21. With median age of 15, and you can see very efficacious and with very few side effects. So we are in front of very, very clear and safe data. So the idea is that for this indication, canakinumab is a very good and also a very safe drug. We have also a very good news for Romania. 2 days ago, we have the protocol for using canakinumab in autoinflammatory diseases. All of you can see them in the Monitorul Oficial, and you can find there the conditions, the inclusion criteria, the exclusion criteria, and the way in which you can prescribe them. So we are at the final of this very interesting afternoon, and we are in the beginning of using a new drug in Romania, and we are very keen. Maybe we will need your help sometimes, and we are happy that you are here today, and maybe you will answer also to our questions in the future. Thank you so much.